Hi everybody and welcome back. In this lecture we will be reviewing the facial bones anatomy. So we have 14 facial bones. Only 2 of these bones are unpaired, and those are going to be the vomer and the mandible. Everything else is paired. So we have 2 maxilla, 2 zygomatic bones, 2 lacrimal bones, 2 nasal bones, 2 inferior nasal conchae, and 2 palatine bones. As you can see in front of you, color-coded pictures. These are going to be your best friend when it becomes the time, which is now, to start learning facial bone anatomy. Alright, to start we have the maxillary bones. These are the largest and movable bones of the face. Each maxilla assists in the formation of the 3 cavities of the face, the mouth, the nasal cavity, as well as 1 orbit. Each maxilla consists of a body and 4 processes that project from that body. So to review the processes, we have the zygomatic process. This projects laterally to unite with the zygoma. The alveolar process is the inferior aspect of the body of each maxilla. The frontal process extends upward toward the frontal bone. And then lastly, we have the palatine process, which forms the anterior portion of the roof of the mouth, which is called the hard palate. Something also to note, the anterior nasal spine, which we can see on the right-hand picture. It's where the 2 maxilla unite anteriorly in the midline. A landmark that we will be noting is the acanthion. This is the midpoint where the nose and upper lip meet. Last but not least, each body of the maxillary bone contain a large air-filled cavity called the maxillary sinus. Something also you guys will need to know now that we're looking also at facial bones, we need to know what facial bones articulate with what other facial bones, and also if any facial bones articulate with any cranial bones. So, the maxillary bone articulates with 2 cranial bones, the frontal and the ethmoid, and then it also articulates with 7 facial bones, the zygoma, the lacrimal, the nasal, palatine, inferior nasal conchae, the vomer, and the adjacent maxilla. This picture is just showing you what the hard palate is, the inferior surface. So as you can see, the right palatine process of the right maxilla and the left palatine process of the left maxilla, and then the purple part is actually the palatine bones. Also, something that you can see are the pterygoid hamulus of the sphenoid bone. Moving on to the zygomatic bones, these are located lateral to the zygomatic process of each maxilla. They form the prominence of the cheek and make up the lower portion of the orbit. The zygomatic arch projects posteriorly from the zygoma that connects with the zygomatic process of the temporal bone. The zygomatic prominence is a positioning landmark and refers to the prominent portion of the zygoma. The zygomatic bones articulate with 3 cranial bones, the frontal, the sphenoid, and the temporal, and it articulates with 1 facial bone only, which is the maxilla. Moving on to the lacrimal bones, these are 2 small delicate bones that lie anteriorly on the medial side of each orbit, just posterior to the frontal process of the maxilla. So as you can see on the left-hand side, the lacrimal bone, again, pretty much posterior to the nasal bone area, and then the lacrimal bones looking from the front are pretty much in like right behind your eye, pretty much in the corner. Lacrimal is a derived word of tear. The lacrimal bones are closely associated with the tear ducts. The lacrimal bones articulate with 2 cranial bones. We have the frontal and the ethmoid, and it also articulates with 2 facial bones, the maxilla and the inferior nasal conchae. So, nasal bones. So as you can see on the right-hand side picture, the nasal bones are two fused bones that form the bridge of the nose and vary in size. Obviously, nobody's nose is the same size and or shape. The nasal bones lie anterior and superior medial to the frontal process of the maxilla and inferior to the frontal bone. The nasion is another surface landmark. It's the point of junction of the two nasal bones with the frontal bone. So again, looking at the right-hand picture, nasion is pretty much kind of like right in between your two eyes, I would say. The inferior nasal conchae lay within the nasal cavity. They're curved or scroll-shaped. They form the lateral walls of the nasal cavity on each side and extend medially. There are three pairs of nasal conchae. The superior and middle pairs are part of the ethmoid bone, and then the inferior pair consists of separate facial bones, which are the inferior nasal conchae. They articulate with one cranial bone, the ethmoid, and they articulate with three facial bones, the maxilla, the lacrimal, and the palatine. Moving on to the palatine bones, as you can see, they are pretty difficult to visualize if we're talking about imaging them, because they are located pretty internally, as we can see that picture on the left-hand side, the purple area. It is an L-shaped bone. The vertical portion of the L extends upward between the maxilla and one pterygoid plate of the sphenoid. The horizontal portion of the L makes up the posterior portion of the hard palate. It articulates with one cranial bone, the ethmoid, and articulates with four facial bones, the maxilla, the inferior nasal conchae, the vomer, and the adjacent palatine bone. The vomer is a thin triangular bone that forms the inferior posterior part of the nasal septum. The surfaces of the vomer are marked by small furrow-like depressions for blood vessels. This is usually where a nosebleed occurs. The vomer articulates with two cranial bones, the sphenoid and the ethmoid, and it articulates with four facial bones, the right and left palatine and the right and left maxilla. Something to note, because this can become a little confusing. The ethmoid and the vomer form the bony septum. The perpendicular plate superiorly and the vomer inferiorly. So, bony septum is pretty much two things combined into one. The ethmoid and the vomer. The perpendicular plate is the superior portion, and the vomer is the inferior portion of the bony septum. The last facial bone we have is the mandible. It is the largest facial bone and the only movable bone in the adult skull. It is two bones in an infant, which join to become one at approximately 1 year of age. The angle or the gonion of the mandible divides each half of the mandible into two main parts, the body and the ramus. The lower teeth are actually rooted into the mandible. The single body forms each lateral half and unites at the anterior midline. This union is called the symphysis, pretty much very similar to the pubic symphysis. It's just the two sides of the mandible joining in the center to create one bone. The mental protuberance is the flat triangular area below the symphysis, marked by two knob-like protuberances that project forward. This area is usually described as just the mental point. So pretty much just where your chin is a landmark that we're going to be using called the mental point. The mental foramen is located on each half of the body. It serves as a passageway for the mental artery, vein, and nerve, which pretty much serves the lower lip and chin area. The ramus terminates in a U-shaped notch, termed the mandibular notch. Pretty easy to remember. Coronoid process. The process at the anterior end of the mandibular notch. So don't get this confused with the coronoid process in your elbow, or the coracoid process on your scapula. Then we also have the condyloid process, which is the upper part of the ramus and consists of two parts. The condyle head, which fits into the TM fossa of the temporal bone to form the TMJ. And then we also have the neck area. All right, I'll add one more thing. So the orbits, it's technically formed by 7 bones. The orbits is not just considered one bone. So we do refer to the orbits as a facial area that we do image, but to talk about the anatomy of the orbits, we need to know that it is composed of 7 different bones itself. So when looking at the bony composition of the orbits, we need to be able to identify the cranial and facial bones that make up the orbit. The cranial bones that make up the orbit are the ethmoid, the frontal, and the sphenoid. And the facial bones that make up the orbit are the lacrimal, the maxillary, the palatine, and the zygomatic. So the circumference or the base of each orbit is composed of 3 parts. This is pretty much just like the outside rim of the orbit. So this is the frontal bone, the maxilla, and the zygoma. The medial wall will be the lacrimal, and then the posterior wall will be the sphenoid, the ethmoid, and the palatine. So sphenoid, ethmoid, and the palatine bone, which is very tiny. Last thing I want to talk about is the openings in the posterior area of the orbit. We have 3 different openings, as you can see in the picture on the right and the bottom. We have the optic foramen, which is a small hole in the sphenoid bone. The optic nerve passes through here. The supraorbital fissure, which is the opening between the greater and lesser wings of the sphenoid. This allows transmission of the 4 primary cranial nerves, which control movement of the eye. And then the inferior orbital fissure, which is located between the maxilla, the zygomatic bone, and the greater wing of the sphenoid. It allows transmission of cranial nerve 5, which permits sensory innervation for the cheek, the nose, the upper lip, and the teeth. And lastly, this slide is just showing you 2 pretty common orbital fractures. Most common one probably is the blowout fracture, pretty much where you get hit, punched, kicked, I don't know what, in the eye, pretty much blows your eye out. And then the one on the left-hand side is what we call a tripod fracture, where it's pretty much breaking in 3 different areas.